Hi, very good day to all of y'all, and thank you very much to the organizers for inviting me for this very nice convention today. Right, so you've had a day of type 1 introduction for diabetes and Ramadan, and I shall continue. So my name is Vijay, and I'm from Putrajaya Hospital, Malaysia. And my task today is to talk about pump technology helping exercise in Ramadan. Um, so, Type 1 patients have many decisions to make to manage the diabetes in a day, and this could be as many as 600. So, you can imagine the complexity of management that they need to have on a day-to-day basis. We have heard that adjusting insulin is very complex. And when you add exercise and fasting into this equation, there are layers of complexities involved that can be very taxing to manage. So it's been called walking on a tightrope. But I don't think it's as simple as walking on a tightrope, not that I've ever tried it before. But some patients have actually tried to describe it as this. So it seems very daunting. So in the past, increased risk of hypoglycemia is often cited as a barrier to participation in fasting during Ramadan in people with type 1. And it also independently has been cited as a barrier to exercise and to increase physical activity in the same sort of patients. But currently, fasting is increasingly being accepted as safe in the right patients with type 1 diabetes. Yep. So risk stratification is important to identify potential patients that could run into trouble. It is made possible with analog insulins and technology. So you've heard about CGM and different insulin delivery devices at the advanced hybrid closed loop system after this. Yeah. Also made possible with educational programs specifically targeting for adjusting insulin normal eating. In the past, many could never attempt to fast and never could complete fasting. So we know that it could be 28 to 30 days. At best, a third would be able to complete fasting. But now, with new technology, there is reported completion of fasting in 50 to almost 98% of people who attempt to fast during Ramadan. So this is very promising indeed. Depending on culture, patients might need to adapt. Obviously, eating habits change, physical activities change, sleep patterns change as well during Ramadan. And therefore, managing these patients who wish to fast and exercise can be challenging. So let's talk a bit about type 1 and exercise, not particularly during Ramadan. Right, so most patients, as we know, do not engage in enough regular physical activity. Basic regulations or recommendations are about 150 minutes of exercise each week, no more than 2 consecutive days of no activities. Resistance trainings is now recommended 3 times a week. And for younger children and young people, it's at least 60 minutes a day. So we know that this glycemia in these individuals can occur during exercise and also after exercise. So what happens during exercise? Glycemic response is influenced by location of insulin delivery, so where your deposition of insulin is, amount of insulin in circulation, glucose concentration before exercise, composition of the last meal or snack, as well as intensity and duration of the next activity. Right. So if they train to exercise or individuals untrained to exercise, typically would require an increased carbohydrate intake or a top up or an insulin dose reduction, or both before commencing aerobic exercise. So we know there's aerobic exercise and there's anaerobic exercise, and both give slightly different excursions in type 1 diabetes. Yeah. So resistance exercise is associated with better stability than continuous moderate intensity aerobic exercise. So what happens after exercise? Um, so there's an immediate cessation of glucose uptake into muscles because the exercise is stopped. But as a whole, glucose disposal remains elevated for several hours. And this is because they're trying to replenish glycogen stores in the muscles. And this can last from several hours to up to 48 hours. So the risk of hypoglycemia is noted to be elevated for at least 12 to 24 hours in most people who've exercised, also seen up to 48 hours in some who've exercised. So you can see that the exercise effect is like the insulin effect, right? So there's an immediate effect and a delayed effect. Some people call it biphasic. So in a nutshell, aerobic exercise like running and cycling and swimming can lower blood glucose in the near immediate effect. And then anaerobic exercise raises blood glucose transiently immediately after. But the longer duration of and the greater intensity of exercise, there is a larger drop in the blood glucose level. So it's never an exact science. And those who practice high intensity interval training may find that occasionally it stabilizes blood glucose profiles. It's very variable. So this is just to simplify the variability in sugar responses to different forms of exercise. Yeah. So aerobic exercise, you can see that the sugar tends to just go down. And intensity and duration, as I mentioned earlier, insulin to glucagon ratio, fitness, nutrition, and initial glucose concentration on commencement of exercise are the main variables that determine what happens after exercise. And on the extreme right, you can see is when you do an anaerobic exercise, which is like strength training or a sprint, where the sugar can tend to go up, but eventually all types of exercise will result in a lesser sugar profile. Just as a takeaway or precautionary message, if your patients intend to exercise, you need to carefully tease out the ones who have got who will need a closer monitoring. So those who are prone to ketosis, if there's a situation with elevated ketones, they should not be allowed or given permission to exercise, if I may say so. A recent hypoglycemia increases the risk of recurrent hypoglycemia. And if there is complications such as unstable proliferative retinopathy, severe autonomic dysfunction or renal failure, then exercise is advised with extreme caution. So there's this, not many research has been done on exercise and fasting in people with type 1 during Ramadan. So this was recently published in September, which was quite interesting because they were seeing that the effect of timing of exercise on glucose control, right? So it's done out of Kuwait for about 12 months. Just quickly look at basically young people with duration of diabetes about 20 years. And if you can look at table 2, quickly looking at time in hypoglycemia, that you will realize that the first 3 columns are the ones who did exercise in the afternoon versus the ones who did exercise in the evening. So the ones who did exercise in the afternoon were advised to do it 1 hour before breakfast of iftar, and the ones who did in the evening was 1 hour after breakfast and iftar. So time spent in hypoglycemia was not much different, regardless of timing of your exercise. But yeah, so the intervention was exercise, as I mentioned just now, before or after iftar, and they were crossed over after a week with a 1 week washout period between. Exercise was 3 classes a week on a video call, totaling about 30 to 45 minutes of exercise each. And they had CGMs to measure sugar control before, during, and after the intervention. Um, as I would like to recap, the exercise timing did not alter time below range, but and they surprisingly could show that the sugars were better the next day after exercise. Um, and those who did exercise in the evening, those were the ones who did exercise after breakfast, iftar, had better time in range the next day. So suggests that it can be done in a safe manner and controls much better with increased time in range the next day for both groups of exercises. Yeah, but this couldn't I wasn't particularly sure if the patients on those recruited were on pump or on MDIs, and therefore we come to the next part of my talk where we want to make it safer for a person with type 1 to exercise during Ramadan. So ways to make it safer would potentially be the pump technology and the continuous glucose monitoring systems technology. Um, the advantage that the pump gives you is that you could flexibly titrate basal rates according to specific times of the day. So we now know for sure that the insulin sensitivity is increased during the last 4 hours of fast. So we now recommend that if you're on a pump, you would want to reduce your basal rate 4 hours before iftar by 20 to 40%, and to reduce your basal rate the whole day during fasting by 15 to 30%. So needs a bit of timing of reduction in basal rate to be done. But with the advanced systems, the hybrid closed loop pumps, it's increasingly, it comes with increasingly accurate and reliable sensors. And therefore, the risks of hypo, which is what we worry about most, is much mitigated when you fast with this advanced system. So that seems to be very promising. So the current guidelines for managing exercise in type 1 remains the same in Ramadan. If you want to start exercises, you should be in the range of 7 to 10 millimoles per liter. And if you were to do an aerobic activity that lasts longer than 30 minutes, then additional carbs are likely to be needed, top-ups, and that would mean that you would recommend exercise to be done after iftar, where the eating and drinking is not restricted. Yeah, so if your patients were on multiple daily injections, then insulin reduction is as such. So the post-exercise bolus is reduced by up to 50% and the basal by up to 30% after exercise. Slightly different changes can be made if you're on a pump therapy. So reduction of bolus pre-exercise and an attempt basal pre and during and post-exercise. And when you're using an advanced hybrid closed loop system, it gets a bit easy. So you use the temporary target just before exercise or a couple of hours before exercise. And you could just go back to the basic, your regular settings at the end of exercise, because the pump kind of takes care of everything else in between. All right, so if you're in a high advanced system, this is what we recommend. You temp targeted at 8.3 for exercise. And if it's an anaerobic activity, you may not require to do temp targets. You can stick to your target, whichever one it was, before exercise. You might not necessarily need to eat the carb before exercise, because that increases the risk of hypoglycemia. So an advanced hybrid closed loop system seems to make exercise much easier, because you just switch it on, the temp target before exercise, and after exercise it's off, and there's much less titration going on afterwards. Yeah. So when is a good time to exercise during Ramadan? There's not much of research done, but because we now know that if you're doing a prolonged exercise, then you want to do it when eating and drinking is not restricted. So there will be no one-size-fits-all sets of guidelines in Ramadan and in those who want to exercise. We can see that physical activity presents additional challenges, and by far the hybrid closed-loop system offers benefits for improved time in the glycemic range overnight, where fear of hypoglycemia is the highest, um, even under demanding environmental and unplanned conditions. So that comes to the end of my talk. With that, I thank you.